Well, good afternoon, everyone, and welcome to today's Lunch and Learn webinar on quality improvement activities to manage care for patients with diabetes mellitus. We thank you for joining us on your lunch break for this third webinar in the Quality Improvement series and the first for 2023. This presentation provides many valuable ideas that will assist in general practices meeting PIP QI activity requirements for Quality Improvement Measure 1. My name is Angela Heathcote and I'm from Eastern Melbourne Primary Health Network. I'd like to thank our speakers for today, my colleagues from the Digital Health team and General Practice team, Barb Repkin, Julie Allardyce and Thomas Perry. I would like to start this session on this beautiful sunny summer's day by acknowledging the Wurundjeri people and other people of the Kulin Nations, on whose unceded lands our work in the community takes place. We recognise and value the knowledge and wisdom of people with lived experience, the supporters and the practitioners who work with them. We also acknowledge the traditional custodians of country throughout Australia and wherever you may be dialling in from and their connections to land, sea and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So for the next two PIP quarters, we'll be promoting Quality Improvement Measure 1, which is the proportion of patients with diabetes with a HbA1c measurement result recorded in their record within the previous 12 months. So to assist your team with this activity, today we're going to be covering quality improvement activities directly linked to this quality improvement measure, diabetes and HbA1c, data quality, how the Walrus tool can assist you, and for any questions for our presenters today, please use the Q&A section and we'll answer these at the end of the session. So to get the session started, I'd like to pass over to Barb. Thanks, Barb.
Oh, hi, everybody. These quality improvement activities we're focusing on today will be for improving the health of patients with diabetes. We've tried to meet the needs of all of our practices by having multiple activities focused on diabetes management. These activities for some practices will be the first activities to start on, and there are multiple activities practices can choose to complete in the future, or if your practice may be at a higher maturity rate and can move on to other activities such as diabetes cycle of care, etc. As there are so many quality improvement activities in this topic, as has happened in the past, we won't be hosting another webinar till August because there's so many activities for you to do. And the four activities that we'll be focusing on today are ensuring diabetes is recorded correctly, that all measures are recorded, ensuring all patients with diabetes have their HbA1c measured at least every 12 months, and all patients with diabetes have a current GP management plan, team care arrangement, and that those items are reviewed regularly. This is the aggregated polar data across the Eastern Melbourne catchment. You'll notice a significant difference in the number of patients who have type 1 and type 2 diabetes, having had their HbA1c measurement recorded. We believe this may be due to patients with type 1 receiving care from multiple providers outside your practices, and the data doesn't always come into the practice in a way that Polar can pick it up. An example of this is a scanned document from other providers. The data needs to be entered into the patient's diabetes record if this is the case, or it needs to come in as an electronic pathology result for it to be picked up. And the third graph is patients who have a diagnosis of diabetes unknown type. If your practice has patients with unknown type, they need to be coded correctly in your clinical information systems. This needs to be done by editing the past history, and we will cover this today. So we've identified a number of activities, and doing individual quality improvement activities will increase the performance in other areas as well. We've got 4 PDSA templates to share with practices today, as well as a walkthrough on Walrus installation and setup. Just note and remember, these are individual activities. Practices can choose the activity that suits them. Firstly, ensure your processes are correct. And again, just the incoming pathology needs to be in a format that is readable bipolar. And if they're coming in from third parties, they need to be added into the diabetes record in your software. The first PDSA is to ensure all your patients with an active diagnosis of diabetes are coded correctly. The second PDSA is to identify patients who have diabetes and have not had their HbA1c measurement recorded in the past 12 months. We need to recall those patients. And the third PDSA is to install Walrus, which will prompt GPs and nurses at the point of care if patients haven't had their HbA1c measurement recorded, or also if the patient is eligible for a GP management plan, team care arrangement, or a review item. And the fourth PDSA is to identify patients in POLAR who have an active diagnosis of diabetes and don't have an active GP management plan or team care arrangement in place. And just to note, remember that you do not need to address all of these activities in one PIP quarter. That's why we've given you multiple PDSAs. They can be spread over multiple PIP quarters. And I'm going to hand over to Julie, who's going to take us through this one.
Thanks, Barb and Ange. The next few slides will be about keeping your clinical information system updated and using the correct coding on how to find diabetes unknown in POLAR. We need to make sure the processes of receiving information from third-party providers align with having the correct information in our clinical information systems. If pathology is coming in manually, the measures will be picked up by POLAR. But as POLAR is not able to read scanned documents, if patients are seeing third-party providers and the information is received as a letter or document, you will need to add the information into the diabetes record into the patient's file. It's a good idea once you've scanned the documents into your clinical information system to keep them and give them to the appropriate clinician to add all the measures into the diabetes record at a later stage. Please note all these screenshots that we're using today are dummy data only. For practices with medical director, in a patient file, go to clinical, then diabetes record, and add all the value you have received in the letter as this is best practice, and then you can save this. For those with best practice, open a patient file, go to the enhanced primary care down the left-hand tree, then go to diabetes cycle of care, add new values, and then add the information into the fields. We will now look at data quality and coding. Before beginning any QI activity, always remember your data cleansing to keep your database up to date by making patients inactive. If you need instructions on how to do this, you can please contact the digital health team. It is common to see patients being coded as having diabetes mellitus unknown type, but these patients need to be coded correctly as diabetes mellitus type 1 or type 2. To find out if your practice has any patients that are coded as having diabetes mellitus unknown, open the POLAR clinic summary report, select the clinical from the black ribbon, and then diabetes QI from the filter. No, you don't need to make notes. You will get a walkthrough about these steps. Will be provided in the PDSA 1. Now you select the blue box, which is active patients with an active diagnosis or medication. Then in the table, most recent coded diabetes, select diabetes mellitus unknown type. You can then go to the patient list on the top right-hand side and export to sort the list. And please note, some practices may not have any uncoded diabetes. You can then sort this list by using the most seen clinician filter. The clinician will need to enter the past history item into the clinical information system to diabetes mellitus type 1 or diabetes mellitus type 2 or gestational diabetes. You may find that you have multiple items in the past history you will need to edit or delete. So please ensure you collect baseline data before completing this activity. And this is how to edit the past history items to reflect the correct diagnosis. For best practice, in a patient file, select past history, select the incorrect diagnosis, then edit, to code diabetes mellitus type 1 or diabetes mellitus type 2. Please note you may have to do this several times if they have been added incorrectly several times. Now this is for Medical Director, so open the Past History tab, highlight the incorrect item, then edit the item to the correct diagnosis of diabetes mellitus type 1 or type 2. And again, you may have to do this several times if it's been recorded incorrectly several times. Now, please allow 24 to 48 hours for POLA to refresh, after which you should no longer have any patients with diabetes mellitus unknown type. Thanks, everyone. And I'll pass back to Barb.
What is HbA1c? For those of you that are new to general practice, it's a simple blood test that measures your average blood sugar levels over the past 2 to 3 months. And it's one of the commonly used tests to diagnose prediabetes and diabetes. It is also the main test to help patients and their healthcare team manage their diabetes. And this is also one of the PIP QI measures that was set by the Department of Health a few years back when the PIP QI started. It's quality improvement measure 1, which is the proportion of regular clients, you will all know them as RACGP active patients, who have diabetes and who have a HbA1c measurement recorded within the past 12 months. So to see this, we need to open the POLA PIP QI report and access the information, which is the little blue box. You'll have POLA, you'll have PIP QI rather than PIP QI demo. And this is what the report looks like. The report will default to opening in the diabetes tab up the top. And in the overview table on the left-hand side, you'll see under diabetes, the quality improvement measures are broken up into diabetes mellitus type 1, diabetes mellitus type 2, and diabetes mellitus unknown type. Again, to mention, some practices may not have any of the diabetes unknown type. And to get the names of the patients who haven't had their HbA1c recorded in the previous 12 months, you will need to select each of the QIM measures one by one. So select QIM 1.1, 1.2 or 1.3 separately. And then you select the orange box, which says click to select patients, and then go to the patient list up the top right-hand side. Once you have done that, the patient list will load and export the lists. Just to note that high numbers in these lists may indicate a data quality issue, and that's why we recommend you prioritise your processes first and your data quality first before attempting this PDSA. So once you've done that, these are the patients that you will need to recall to have their HbA1c measured. And you can track the progress using the graphs in this PIP QI report, or you can see this same information in your practice report on page 4. So anyone that doesn't receive one of these, just email Digital Health again, and we will make sure you get your practice report. They are distributed now quarterly to all practices that have POLA. And for practices that don't have POLA, you can actually get the same, you can get this report by logging in to the portal where you actually leave your JSON file or CSV file now for PIP QI. So you will be able to see your practice's screening rate, but you'll not see the benchmarking figures in POLA, but in your practice report, you will actually see your figures and how you benchmark against the MPN catchment, the top 10 in our catchment, and also you'll be able to see how you benchmark against the Australian average as well. So that is that PDSA 2, which you will all get a copy of when we send out the email later, is just PDSA 2, increasing the HbA1c measurement for patients with diabetes, with all the instructions in it and a template for you to adapt for your practice. Or you can opportunistically identify patients who are eligible for screening using the Walrus tool. For those of you who haven't heard or seen Walrus in action, it's available free of cost to all practices who have Polar installed and who are using best practice or medical director. And you can see from the screenshot here, there are notifications for a number of measures and demographics, missing demographics. You can click on the icons, which operate like a series of traffic lights, and alert you to missing items or missing MBS items as well. What a lot of you may not know is that Walrus is actually customizable. You can edit users to only receive notifications for the HbA1c measurement and the chronic disease items, and no other prompts will show. I know it can be a little bit overwhelming when you've got all of the prompts there, but it's a really good way to introduce Walrus to your providers. You can add additional prompts and notifications at a later stage, but for the purpose of this diabetes activity, you can actually just have the two prompts showing when the doctors open a patient file. It will just prompt them if they don't have a HbA1c measurement recorded, and also prompt them if the patient doesn't have an active GP management plan, team care arrangement, or they need those items to be reviewed. The other thing to note is that the software vendor is having a webinar on the 8th of March. It's a 30-minute webinar at 1 o'clock, and they're going to be covering setting up Walrus and setting up prompts and notifications, and you can even set up roles in Walrus as well. So you can actually set up roles for your clinicians, your nurses and your doctors if you want them to receive specific prompts. So you can register for that on the front page of Polar, or you can go to the MPIM website under events, and we've actually advertise that event there, or we will also put the registration link in a copy in the email that we send out at the end of the session today. So again, this is another PDSA, implementing Walrus in your practice, and today we'll also be sending out the installing Walrus and adding users and user management walkthrough for implementing that in your practice. And our digital health team is very keen to get as many practices up and running with Walrus this year as we can. So we're very available to assist you with that, either over the phone and TeamViewer, or we're happy to come out to your practice and assist you with that as well. You just need to email us at digitalhealth@mpin.org.au. I'm now going to hand over to Tom, who's going to take you through the next activity.
Thanks, Barb. So our next activity is how to identify patients who have an active diagnosis of diabetes mellitus, who do not have an active GP management plan, team care arrangement in place, or they are due for review of either of those items. So to do this, we need to open Polar and select the clinical summary report. The first page we will land on is called the dashboard page. And on this page, we will apply the patient active filter and RACGP active filter by ticking the RACGP and practice active patients shortcut filter box, which is on the top right-hand corner. A quick reminder here is that active patients are those who are active in your clinical software, and RACGP active patients are those who have attended your practice 3 or more times in the last 2 years. Next, we'll navigate to the filters, which are on the left-hand side, and we'll expand the filter heading Diagnosis. Select the Diagnosis Active filter, and then confirm the selection by clicking on the green tick box. We will now navigate to the Diagnosis page by clicking on the clinical heading in the top black banner and selecting Diagnosis from the drop-down menu. On the Diagnosis page, we will select the Chronic Disease Categories heading in the middle column of the page, and then select Diabetes from the graph on the right-hand side. Again, confirm the selection by clicking on the green tick box. So we're now looking at patients that are active, RACGP active, and have an active diagnosis of diabetes. We will now navigate to the Tracked MBS page, and we'll do this by clicking on the MBS heading in the top black banner and selecting Tracked MBS from the drop-down menu. The table at the top of the page will default to loading the tracked MBS item GPMP. With our current filters in place, the table will display how many active RACGP active patients with diabetes have an active GPMP, expired GPMP, or never had a GPMP. Navigate to the red buttons in the middle of the page associated with the red To Action heading and select either expired or combined. When the patient counter number in the top left of the screen changes and matches the number under the red To Action heading, navigate to the patient list in the black banner at the top right corner of the page. When the patient list is displayed, use the Export to Excel button to sort the list, for example, by most seen clinician, and then save the list or print it as necessary. If needed, you can change the focus to TCA by removing the GPMP filter, which is displayed in the grey banner at the top of the page, and then selecting TCA in the table at the top of the page. Recall the patients via your practice's preferred method, such as SMS, phone, letter, etc. So to search for patients with diabetes who are eligible for a GPMP or TCA review, firstly, remove the filter for GPMP or TCA, which we applied just before. To change the frequency of the reviews, use the toggle buttons located on the right-hand side of the page under the heading Tracked MBS Review Eligibility. You can choose 3 months, 6 months, or 9 months. Navigate to the blue buttons in the middle of the page associated with the blue Partially Claimed heading and click the Select Eligible for Review button. To change the focus from GPMP to TCA, select TCA in the table at the top of the page. When the patient count number in the top left of the screen changes and matches the number under the blue Partially Claimed heading, navigate to the patient list. When the patient list is displayed, use the Export to Excel button to sort, save, or print as required. And again, recall patients via your practice's preferred method. So I'll just hand over to Ange now.
Thanks, Tom. So it's been a lot of information that we've gone through today. So in summary, you can decide which of the QI activities is suited to your practice. So identify which activities will form part of each PDSA. And if you have high numbers of patients in each of these activities, you may need to spread these over numerous quarters. As Barb said, don't try and attempt to do it all in one quarter. Maybe sit down with your team and decide which one you're going to tackle first. You can decide as to whether you have undefined diabetes. Do you need to jump onto that first as your main target first and then move on to the other activities? So determine how your activities will be sustainable into the future. One of those would be around looking at your patients who do have an undefined diabetes, making sure the team are all on board with how they're coding and making sure that's a continuous activity that they do into the future and not something that you have to do every so often to make sure that you're keeping up to date. Ensure you involve the whole of the practice team in the process so that, like I said, you're not going back every 6 months and having to print off lists for those to be actually recoded again. And most importantly, celebrate your successes. Once you get through and improve your processes, it's worth celebrating with your team. So what's next? Addressing data quality is the first step, as we said. Always involve the clinicians in this, an absolutely important step for everyone to get involved. Completing your diabetes cycle of care and addressing any gaps in diabetes care by following up patients who need assistance with their diabetes management team. So if you have any suggestions of what you'd like us to cover in future events, make sure you pop them in the Q&A and we will actually address those for you in next topics. So the QR code on the screen here gives you a direct link to our Polar page in our MFM website. And this is where you can find all of our PDSAs, walkthroughs and Polar resources. It's a really valuable resource there. All our previous topics that we've covered in our previous webinar series is covered there as well. So go there as your direct link. Obviously, you can always email our team if you're unsure where to get what particular resource you're after. There's also a link on here as well for a direct link to the Handbook for Management of Type 2 Diabetes available for downloading at your practice. We've actually just going to spend a few moments now. We've got a little bit of time to go through any questions. Or if you actually would like to share with the group here how you're managing diabetes in your practice, or you've actually completed some activities that you'd like to share with everyone, pop your hand up or pop it in the chat and we're happy to go through it for you. Let me just go through. I think I've got one question here. The question is for Barb and Tom, is WARIS similar to Doctors Care, Doctors Control Panel? Can you achieve the same thing through DCP with regards to diabetes management?
You definitely can. It's a very similar tool. I would say probably the only difference is that the other, the Doctors Control Panel requires you to pay a subscription, whereby your having Polar, your practice is has that free of charge, but very similar.
Thanks, Barb. We will make contact with practices through these PIP quarters to see how you're all going. And obviously, if you've got some great success stories and you're happy to share with us, we'd love to hear about those as you go. Oh, there's a few more that have popped up just as I'm talking. Is WARIS, here we go. What are the dates for PIP quarters?
Okay, this is going to test me. We've just started we're in quarter 2 currently, which is the 1st of February till the 30th of April. And then we have 1st of May to 31st of July. And then the 1st of August through till the
October.
31st of October. Yes.
Well done, Barb. Julie was ready to jump in there, I think.
Yeah.
Thank you. And is diabetes cycle of care still billable under Medicare?
Oh, that's a good question. I think the SIPs, Julie might be better to press to answer that one.
There are no more SIPs, but it's still, I think, a good clinical measure to record your diabetes cycle of care, but there's definitely no SIP payment like there used to be. Yeah.
Mm.
Hence why the link to the QI activities is a good one to do, isn't it?
Yeah.
Yeah. Okay.
It's another.
Oh, there is another one.
Another question. Yeah. Yeah, absolutely. With the cybersecurity question, you can actually get your IT provider to contact us if they've got any questions about WARIS. Again, digitalhealth@empen.org.au, and we'll provide you as much information as you need.
Thanks, Barb. And I will shamelessly promote our next webinar that we are holding next week on the 28th of this month on cybersecurity. You will find that on our events page, so please come along to that. It's got a great panel of cyber experts coming along to present. So I'd like to thank Barb, Tom and Julie for their time today for their presentations, and thank you all for your attendance.